I'm excited to help facilitate a conversation today between our amazing panelists. But before we do so, I'll go ahead and introduce myself and provide some background information to our topic of discussion today. I wanted to let everyone on this call know that you can use the Q&A and chat function to ask questions. And at the very end, we'll have time for a Q&A. My name is Allison Wudo, and I am Director of Business Development for Genoa Healthcare. I've been with Genoa for about 5 years now, part of our growth and development team. I help support Genoa's growth into new clinics, and I have a focus on expanding our services to impact as many lives as possible. Again, my role today is just to moderate the conversation between our amazing panelists, and I'll introduce them here shortly. Before we get going, I wanted to give a background of whole person care and kind of what it is and why we chose this as a topic of conversation. So starting from the very beginning to level set with everyone, what is whole person care? So whole person care is an approach to healthcare that recognizes that people are complex. It is health is a product of economic conditions, social stressors, environmental exposures, and behavioral factors in addition to physical and mental health. So there's a lot all encompassing to someone's healthcare, and whole person care really resembles that. Rather than focusing on a single issue or diagnosis, whole person care acknowledges that health outcomes depend on so many different factors. It's a patient-centered approach, which I think, at least for all of us on this call, I think is why we're in healthcare, because we want to care about the patient as a whole, not one individual condition. The positive effects that will be shared today throughout the webinar really highlight the positive implications for the high-risk population that we care for. So whole person care uses a comprehensive approach to help patients tackle all issues that they might be facing together. If you like statistics at all, like me, I found this very interesting. So a recent survey found that nearly 60% of behavioral health, primary care, and complex providers reported that their organization currently offered or had plans to begin offering integrated care to the patients that they serve, which is an increase of 7% from 2020. And I think we all know what happened in 2020 that might make a big difference into why people are focused on whole person care now. So why is there focus on it now? Well, just like everything, COVID-19 really shined a light on whole person health by highlighting the correlation between behavioral health and overall wellness, as so many people who were living with behavioral health conditions experienced worse symptoms throughout the pandemic, while others struggled for the first time and didn't know where to turn. Social determinants of health are becoming more important factors in success for both Medicare and Medicaid health plans. And this means a lot for clinics. They're now thinking about different ways and forms to offer whole person care to their patients. One of my favorite ways to think about whole person care is talking to your doctor about your high blood pressure. Imagine you're having a conversation with your doctor, who then connects you to a behavioral health specialist in the building and shares his concerns about your health with you and the behavioral health specialist. Then imagine you work together to identify issues in your life that can be contributing to your high blood pressure, such as financial stress and anxiety. Whole person health looks at the factors that affect your well-being. Health and disease are not separate things. Instead, you can think of them as a path that's connected. So think about whole person health with health in one direction and disease in another. Some things move towards health and some things lead you away from it. When I think about whole person care, I immediately think about sports. On any given team, let's use the Minnesota Timberwolves as an example. There are so many components that make a successful team. So you have the players, coaches, trainers, doctors, nutritionists, psychologists, and more. No team would be as successful if they did not work together to take care of the players. And the Minnesota Timberwolves certainly wouldn't have made it to the Western Conference Finals this year without the approach of taking care of their players in their entirety. So before I let the experts on this topic jump in, I just wanted to give an overview of, I see Go Celtics in the chat. We can save that for another conversation. That just distracted me, but I will let you guys know that there is a poll question in the chat, and we just want to make this conversation as relevant as possible for everyone. So if you could just describe, and all you have to do is select one in the function, answer the poll question. Which of these best describes your clinic? Is it a CCBHC, FQHC, CCBHC, and FQHC? Neither CCBHC or FQHC look alike. You could go ahead and take some time to answer in the poll what your clinic resembles most. In the meantime, I am going to finally introduce our amazing panelists. I'll start with Dr. Vanna Campion. She is the Chief Medical Officer at Terros Health in Phoenix, Arizona. Dr. Campion is a family medicine physician by training and a leader in providing integrated medical care to the community. At Terros Health, she champions initiatives that blend primary care with specialized mental health and substance use treatment, and we're really excited to have her on this panel. Secondly, I'll introduce Vera Sansone. She is the president and CEO of CPC Integrated Health and is responsible for the overall strategic direction and operational performance of the agency. Dedicated to building healthier and more equitable communities and known for being on the forefront of the most recent advancements in mental health and substance use disorders treatment, under Vera's leadership, CPC became the first certified community behavioral health clinic in the state of New Jersey and one of the first in the nation. Additionally, Vera led CPC to become the pilot program to partner with Horizon Blue Cross Blue Shield of New Jersey for the Integrated Systems of Care program, which integrates behavioral health services through coordinated care, a program which is now being replicated all throughout New Jersey. And last but certainly not least, we have Kelly McKevitt here. Kelly is the Executive Vice President of CEO of Southwestern Pennsylvania Human Services. SPHS helps people of all ages by providing an array of services to those in need, including childcare, aging programs, mental health, substance use treatment, homelessness assistance, personal care, nutrition services, and family support. So really a little bit of everything. SPHS and its affiliates offer services to residents of Southwestern Pennsylvania. Kelly also helped design the Centers of Excellence for Opioid Use Disorder Treatment Program, along with many other innovative programs at SPHS. She has a reputation for innovation, agency growth, and team development. Kelly's passion is to help those in need and to be the driving force behind her success. In 2024, Kelly was recognized as Woman of Influence by the Pittsburgh Business Times for making strides in her career while giving back to the community. She was one of 26 influential businesswomen in the Pittsburgh region to be honored with this award. So, to say the least, we have quite the qualified group of people here to talk about whole person care. And I'm going to go ahead and kick it over to Dr. Vanna Campion to start us off by asking her a question. What are the benefits of offering whole person care programs or initiatives at your clinic, and how have you seen an impact on your patients?
Thanks, Allison. I appreciate being here today. So, for the benefits of whole person healthcare and initiatives in our clinic, I think that they're limitless, right? Whole person care really allows us to think of a person and all of their needs. As a primary care physician, in training, you learn like, here's a disease process, here's a diagnosis, here are the medications that treat it. And often you feel frustrated that your patients aren't following your recommendation plan. They're not making any progress. You don't know, like, did they not understand or what's happening, right? That's keeping them from be able to meet their health goals. And whole person healthcare as a primary care physician allowed me to feel more connected to my patients. It allows us to have a better understanding of what is it that they are going through, because we know with hypertension or diabetes, there are so many factors that play into that. Your ability to get food, where you live, right? The environment that you are living in. If you have housing, can you afford your medications? All of those things. And for our patients, I see that patients are a lot more engaged. They're more successful. They're able to actually achieve those health outcomes that, we all want them to achieve with more support. So it has been really fun to be the CMO at Terros Health, where I also get to do primary care, but we also get to look at people's mental health. We address their substance use disorders and really have a network of people that are taking care of the patient. So.
I can add to that.
Pass it on to everybody.
Yeah, I'll be glad to add to that. So here in Southwestern Pennsylvania, we've been providing this array of services that grew over the years, and this is our 60th year, and I've been involved for a little over 30. So historically, when you want to think about how did we see our patients benefit, I've seen that in real time. So I could remember a time where individuals were coming out of state institutions on the mental health side and working as a caseworker and seeing that struggle and not maybe even be able to get in to talk to the physician when they went, and seeing those gaps, to seeing people now, maybe later on in their journey, that they're living independently and they have an array of services that are more coordinated. So for us, it's I mean, some people look at us as a large organization and say, well, you have all these pieces to the puzzle, but that doesn't mean necessarily that everyone that we serve is limited to just our services. Many times they touch a bunch of different pieces. They might get mental health and substance abuse from us, but maybe their primary care is separate, or maybe some other housing piece is separate. So it's really making a commitment to that individual for the best outcome, that we're going to work with all the people, and we are going to be that brokerage and those old time, like I call them old social work, skills to get that done. And just to wrap that up, I think the biggest thing is hearing the feedback from the individuals, because that's the most frustrating, right? Whether you're a family member or you're the individual in care, if you feel like the people that are trying to help you aren't on the same page and working together.
You guys make such great points. I couldn't agree more. I can add that I know for us, we were always integrated with substance use and mental health. We've been doing that for many, many years. But it was extremely frustrating not to be able to help people who were in the emergency room all the time with chronic medical conditions that either they felt there was a lot of stigma when they went to either primary care or other medical practices, or they just did not focus on that because they had so many other issues that they were, and hearing that people with serious and persistent mental illness were dying 20 years earlier than the general population really made us feel like, how can we not do this? So I would just add that.
Yeah, that's a really good point. And you all three make great points. Vera, I'm going to kick it back to you and ask then, what was the first whole person care initiative that you offered at your clinic? And would you recommend it as a starting place for other folks that are interested in incorporating this to their facility?
Sure, yeah. Great question. So for us, again, we were doing mental health and substance use. We've always done case management, social determinants of health, food insecurity, housing, and that kind of thing. So in New Jersey, there was a program that was offered as a potential grant, a behavioral health home, and that brought in medical case management. So we had applied for that and we got it. And what it did for us was to help us start to change the culture with our staff, so that we were all looking at all the components, because in the past, even our medical staff would say things like, this guy's got a really serious chronic medical illness, he should see a doctor, as though there was a separate kind of group that should be addressing those. So I think the behavioral health home really started us focusing on ourselves as a whole health operation. But what really made us feel that this was for us was when the whole idea of the CCBHCs came out. So we thank National Council for being the leaders in that. And when they started talking about it at their meetings, we were like, this sounds amazing. Let's try and convince New Jersey to be one of the states. And from there, we have never turned back, and we really do, we call ourselves true believers when it comes to CCBHC, because we really feel like there's so many different types of formats to use for integrated care, but we really believe that CCBHC is a great model. And so I think for us, that was really a turning point.
Yeah. Kelly, would you say that's similar for you guys at SPHS, or what was the first kind of initiative that you guys offered with regards to whole person care?
Since our hallmark has always been that, I think for us, when I think about, your question, I hear, Vera talking, and I'm sure her and Dana, they've all experienced this, is that, sometimes these initiatives come upon you because of funding or an opportunity that comes up, and that's great. But even if you don't have that opportunity now, you can start working as an organization about like a cultural shift, because that starts all the way from the beginning when you're screening people from hire, and you're onboarding, and your training, and your board, and your leadership, strategic planning, mission vision statements. All that is about that, because then it's ingrained in the everyday work. The example I use is, I can remember a time where in mental health, and Vera might remember this, like that they say you have to coordinate, the insurance companies were saying, like, you have to coordinate with an individual's primary care. And a lot of clinics created a form and said you have to make a checkbox, and then they got the EHR and they build that into their EHR. Well, I use that as an example and say, don't make this a checkbox, because then the staff and the physicians just become overwhelmed where this is another thing that I have to check off and I'm just trying to help people. It needs to really start with at the basis that this is our culture, this is our mindset. So I loved when Vera said like true believers, because that means that that organization really believes this is what's best for the individuals. And if we get everyone on the same page, the actual initiatives will be so much easier. They'll just be like a rollout.
Yeah. And I love that. And I know prior to this, we had a conversation about that. And I would just ask, how do you encourage your team to buy into the idea of whole person care and the extra work that might come along with it? When you talk about building a culture, could you expand more on how you guys were able to do that?
I think sharing the benefits, having the information, and we can, having information from FQHCs, CCBHCs, other models, and showing them appropriate outcomes. And actually having individuals, we have a lot of peers and a lot of individuals in long-term recovery, in mental health, a lot of individuals that have been through our services, and having them talk to the staff and becoming part of that onboarding and ongoing training, to keep mentioning that and build it in, to the supervision. So it has to be both bottom up, and top down, because everyone kind of gets on the same page. And I think it goes back to what we said. If someone really doesn't believe in that, it's digging deeper and understanding, why do you want to compartmentalize? And sometimes it's really not that an individual's not on board with it as far as a staff person. Sometimes it's they got the wrong message. They think you're just trying to put more work on them, and they have more things to do, and they don't really understand, what the initiative is.
That's a great point. And I would just add to that, I know for our staff, we started sharing stories of success that we were starting to see with some of our clients who had, very serious medical issues, hepatitis B. We've been starting to identify things and seeing them treated, and then seeing them be able to focus on their substance use and mental health challenges, and in some cases go on to become peers, go for the training and come back to work with us. And I think there was something about that, making it real, that even those of our staff who were, a little more old school, it felt like it was going to dilute what we do, and we're not the experts in this, and a lot of the stuff that I'm sure Vanna has heard. Thought, okay, let's try it. And so, and being in the same way that we, with our clients, we meet them where they're at and try and work with them so that they can accept and maybe find some common ground. We did the same thing with our staff around that kind of thing.
I love that point. And culture, it reminds me just a lot of Genoa too, because I think I mentioned this to you guys, but one of the things that we offered a few years ago was free mental health first aid training to our entire organization, even people who work from home like I do and not actually patient facing. So buying into culture and starting from the top and really integrating that through everyone's day-to-day and workflow is definitely a game changer. So I can relate to that in some ways, not necessarily the same exact ways, but there are certain things that I can totally see how it just starts from the bottom and then you expand from there. And Dr. Vanna, what about you at Terros Health? How do you encourage your team to kind of buy into whole person care and the extra work that might come along with that?
Yeah, so I think, at Terros Health, Terros started as a substance abuse and treatment company back in the late 1960s. And the teams here have always looked for ways that they can do more and help their patients and be more involved in the community. And so really early on, back in the late 1980s, we started doing HIV testing, which made sense for our patient population at the time. But we did those things in two very separate buildings, and kind of away from each other, right? And that continued for until 2024. So this year we're finally bringing our HIV testing sites into our actual clinics, right? And kind of having more focus on how we do all of those things. But I think having someone who is excited at your sites and about this, who's benefited from whole person care, who has had a medical illness or a family member with a medical illness that's affected their mental health or their substance use, and really sharing those stories. And a lot of times our providers I'm the first primary care CMO at Terros, right? So they've always had a psychiatrist in this role. We've always done mental health and substance abuse treatment. And about 10 years ago is when they really truly added on primary care, but it wasn't given a ton of focus until when I came on 2 years ago. And I think everybody was terrified when I got here, right? She's going to come in, she's going to change everything we do. Primary care has no idea what mental health does. It's just so separate and different. You treat people different, all of the things. And in a traditional primary care clinic, you get 10, 15 minutes with a patient, you're on to the next one, right? And so it doesn't really lend for a lot of that whole person care and that understanding that we see with our mental health patients. However, is not, I got here and very early on, I realized, oh, okay, they're all terrified of me. I need to understand what our mental health providers do, right? I need to truly understand what happens in our clinics and how we're taking care of these patients so I can effectively show our primary care providers how we can help them meet their needs. And so whole person care really isn't about adding additional work. It's about everybody working together and collaborating. So everybody's workload gets a little bit lighter. It's a little bit easier to do the hard work that all of our mental health providers are doing every day because your patient's not in the ER every day, right? Like you're not constantly having to figure out where they are. We're able to take better care of them. And our primary care teams, the patients don't hear, I got this really bad diagnosis from my primary care doctor and they didn't spend any time with me to talk to me about it, right? Because our primary care team knows there's someone right there that can help our patient kind of process this new information and work through it. So it's really just showing everybody that when we work together, everybody's job gets easier and our patients just feel more supported. So that's what we've been doing. And I think we're making a lot of progress from when I got here. So
that's awesome. That's awesome. And I love the self-awareness. You're like, they didn't like me at first. I find that hard to believe.
No, they were terrified.
I find that hard to believe. I'm going to go ahead and kick it back to Kelly. Just explain to me what role an integrated pharmacy partner can play when offering in-person whole person care, having a pharmacy partner such as Genoa on site.
Yeah, so to be honest with you, 8 years ago, that was new to me. We expanded some operations in a county north of Pittsburgh, PA, and that setup was already there. And I thought, well, this is interesting. How's this all going to work? Fast forward to now, we operate around 10 outpatient clinics, and our three largest have the integrated pharmacies, but they also support numerous other, locations. And I think it's so helpful. And I think it's a good example of how you don't necessarily, because I think sometimes there's different people out there in the community and they have a role there and they're doing good work, but it's not in the cards for them to be behavioral health, substance abuse. They might not, it's not easy to run a primary care. So that's the one, right? So I really give Dr. Vanna all the credit because going in and adding that is very, very, that's a heavy lift, and they were able to do it, but that's not in the cards for everybody. But this is a perfect example. You don't have to own everything. We used to own our own pharmacies and we walked away from them. It became too labor intensive for us, too resource demanding. But we have a partnership. So you could establish those same partnerships. I mean, it's nice when you're all employed by the same and you're in the same building, but you could build those same bridges, with other partners. And really, the feedback that we get from the individuals that use the
Mhm.
pharmacy and they're there on site, and I just, there's something special, at least for the ones that we have, and it's only fair to say, I mean, all three of ours are Genoa. I know this isn't a commercial, but I mean, the credit is due where the credit is due, and they really treat our individuals just spectacularly. And also, we have a lot of physicians and psychiatrists that work for us, and they're very good about getting them information. And
Mhm.
physicians have a really hard job. There's a lot of moving parts, and they're able to get good, accurate information, and they're able to collaborate and make sure things are right. If they're adding a medication, if there's an issue where maybe someone says, I didn't take this medication all the time, or I'm having some sort of difficulty, and I think the staff feel supported as well, and they feel part of that same community of the clinic and the pharmacy, because a lot of the staff use the
Mhm.
pharmacy to meet their own needs, and they know they can walk over and they could get something taken care of, and that the pharmacy's there. And I think the pharmacies are just more receptive when they're on site. It's much easier if you're a commercial pharmacy. Someone's calling saying, "Oh, I don't have that on stock. Oh, I can't help you. Oh, it's not working with the insurance. Call someone else. Call the doctor's office. The script's not right." It's just easier to pass you off. But when, the integrated pharmacies right there, you get a much more collaborative, committed effort. And it's just been
Mhm.
everything for us has been a benefit in those locations. I'm trying to convince everyone to have one at our administrative offices. We have very little treatment
Mhm.
here, but we have a very large administrative headquarters, and everyone here wants a pharmacy on site, but there
I
are
love
more
it.
employees than otherwise. So yeah, it's been great for us.
I love it. And I think I know who you can talk to for that one. So I'll have to make sure you're in contact with the right person later. But I like what you mentioned, right? You've got 3 on site, but the 10 other clinics you guys have also utilized that kind of dedicated pharmacy partner as well. And that's great to hear. So, um, Vera, what about you?
I guess that kind of sums it up. We're much smaller, but we feel the same way about having Genoa involved. Again, not an ad, but although I'm more than willing to put a banner out, because I can't believe how great it is, especially with like reconciliation, med reconciliation and assorted other things. Some of our clients who are really, not happy about dealing with pharmacies, and the respect that they get, and the fact that they do coordinate and share information. But just to give you an example, like a real life one that I'm sure a lot of you can identify with, in 2020, I think we had a living, breathing example of what integrated care can do. We had, nothing was open. Primary care doctors weren't answering their phone. Everyone was telling you not to go to the emergency room. People didn't have food. And we decided, all right, let's see what we can do. So we had our partial care folks making vats of spaghetti and putting things together to bring out into the community, along with our family practice APN, who was writing bridge meds because we didn't know when people would be able to get any medications, and our pharmacist, who was delivering meds herself, much less with her, the tech folks that work with her, and our case managers. And if that's not integrated care, I don't know what is. So shots they gave, we never stopped giving shots. There were agencies that were putting people understandably back on oral meds because they didn't have. Everybody was helping out with everything. And to me, that's like a living, breathing example of what integrated care can do.
Yeah.
I would agree. That is an amazing story, actually. But our integrated pharmacies at Terros, they have been extremely helpful partners. Our pharmacists and the pharmacy techs, they know our patients, right? They understand what their needs are. They communicate with our team, like, hey, this person didn't pick up their medication. Is somebody going out to see them later today? Like, how do we make sure that they're adherent to their medications and don't have challenges because of that? They also have been really helpful in administering influenza vaccines every year, right? I don't have to have those at the clinic and provide the oversight for that. Our pharmacy partner is able to manage that for us, and that's been really helpful. COVID-19 vaccines and other preventative vaccines for all of our patients. our pharmacists definitely help with medication management. I remember a time I was working in one of our, when I first got here to understand mental health better, I decided to go 1 day a week and practice primary care at one of our recovery centers, serving our patients with serious mental illness. And it was really interesting. I remember a patient came in and she had all of these symptoms, and I was like, can you just show me what meds you're taking, right? Like dizziness, and she was feeling awful. Like, show me. She was taking duplicates of so many of her hypertension medications. I remember just being like, okay, so I don't know how to get through this, but you should not be taking all these meds, right? And I remember walking over to the pharmacist, being like, hey, so I'm new here, CMO, and can you help me figure out what's going on here? And he spent a large amount of time helping me coordinate with other pharmacies and figure out, does she still have active prescriptions there? What do we need to do to cancel them and get them all transferred so she's getting all of her medications here? He was like, we should be doing a bubble pack for her to make this easier for her. And I was like, what is a bubble pack? I'm not familiar, but yes, let's do that.
Yeah.
And it really just made my job a lot easier in helping to navigate that patient's care, and helping her get what she needed, which was phenomenal. I didn't have to call a bunch of pharmacies myself, and I had that support. So I would say that truly they are a member of our care team, regardless of what organization they work for, right? And we've just been really, really lucky to see the benefits of that for our patients and our providers at Terros. So
That's amazing. And I love the love fest for all of the site managers. It's like, I don't know who has the best, but we can fight about that later.
they're all phenomenal. We'll just go with
Yes,
that.
all 700 and however many we have now. Well, thank you all for sharing that experience with a pharmacy partner. For the listeners, I'd be curious on your three perspective of what advice you might have for a clinic that is interested in incorporating whole person care into their practices, just kind of where to start, or what advice you might have, or things that you weren't expecting.
I could start because I just have probably the smallest thing to say about that. I would just say have a lot of patience and realize it's a continuous evolution, and not to be intimidated and not be afraid, to start taking steps in a direction, because it's really just, incorporating, that holistic perspective, and it's in your core. Most people that work, they want to do that. It's good for the person. If it feels natural to yourself, imagine it feels, natural to those you serve. So I think that would be, my advice, just to start making incremental steps and realize like it's a journey, and you don't have to feel like you have this big initiative, and you did it, and because it's not going to be done even when it's done. There's always going to be, more to do.
Yeah, I would add to that if you're a smaller agency and it feels overwhelming, like the whole CCBHC and all of the things you have to do to be one, maybe approach a CCBHC about being a DCO, which is kind of a subcontract. But in doing that, you are part of that team. And so not only do you get the benefits of, subcontracted payment, but you also get to understand the larger context of how to provide whole health, what your role is in it, and then you can kind of figure from there what you want to do. Or you could start by hiring someone, case manager. And in our case, the first person that we hired, we just lucked out because we were a CCBHC, and we had to do, we were doing it at MAT, but we had to do ambulatory detox. We found a physician who had decided that she didn't want to be an anesthesiologist any longer. She had been doing primary care. She wanted to do addiction work. So she brought the whole 9 yards in, because she was doing substance use, but she also now was advising us on some of the primary care stuff. And then from there, we brought in an APN who was a family practice as opposed to, psychiatry. But if you're not into the medical stuff, if that's like too big, hire a case manager who's worked in medical settings. You can get somebody who worked in an FQHC or in a hospital, and so they have some expertise. So, yeah, like Kelly said, you start small, don't get overwhelmed by it. And then if this is something that you feel good about and you want to continue it, then apply for, to be a CCBHC when that opens up, in your state or something along those lines.
Awesome.
I would definitely echo what both of you said. I think do something that feels natural for your organization and your patients, right? Don't force something just because it sounds like a good idea or there's a funding opportunity. We've definitely made those mistakes in the past, but do something that helps your patients and you'll start the benefit, right? I think for Terros, we started doing HIV testing. Definitely was something our patients needed at the time, right? And now as we're looking at our primary care, I think when our primary care providers have started to look at how they can better meet the needs of our mental health patients, right? Our patients are also having substance use disorder issues. They also have diagnosis of hepatitis C. So we've branched into looking at how do we provide treatment, right, for hepatitis C? How do we help prevent HIV and do HIV prevention? How do we help with those things that we know our patients are already dealing with? It became a lot easier. And so I think for me, it's do what feels natural and what makes sense. But if you say, you're a behavioral health organization and tomorrow you see mainly adults and tomorrow you decide that you're going to serve kids, it's going to be a lot more challenging, right? But if you say, let's look into how do we serve the justice population, maybe that's a good place to start, right? Or something that your patients need. So.
All very good perspectives, and it sounds like you are all aligned with doing something that feels natural to you, which sounds about right to me. So last question I have for you, and then we will go over to any Q&A questions. Just a reminder to anyone listening, if you have questions for these three wonderful ladies, go ahead and put them either into the chat or into the Q&A section. But the last question I have for you all is there anything you wish you knew before offering whole person care initiatives at your clinic? So anything that you wish you could go back in time and know beforehand?
Again, I'll go first. That's easy for me. That's just been the history. So for me to say, we would undo it. And I'm a social worker by trade. Like, it's just like the natural, the natural thing. So, I really can't, I think that you could always know more. We have had experience. We had an FQHC lookalike, and we let that, go and went a different direction with our primary care mixed with MAT. So maybe I could just say, like, have, knowing that you can always, change gears. There's more than one pathway. Maybe that's what I would say. And not, feel pressured, that, because you see another entity and you feel like you're doing good work, and then you see an entity get, some designation or some funding, and that's okay. You look, like Vera said, you could partner, you could work together. But other than that, I can't really think of anything, Allison.
Okay.
I think Terros has been doing, some of these initiatives before I was born. And so, I don't know that I would tell them to do anything differently. I think the one thing that I maybe wish that I knew when I took this job, right, as primary care, is that as a primary care CMO and kind of went into this role, was really that it's just about understanding each other and understanding how each person can contribute to the team. But communicating that. So when you're making the decisions at an executive level, at a director level, right, and you're really driving the mission of your organization, making sure you communicate that early, often, and in a way people understand is really important. And you prioritize whatever that initiative is, right? It's something that you talk about regularly. It's in your strategic plan. It's something that the whole organization sees as a priority and understands the value of, because you've told them. You've helped them see it themselves, rather than just say, we're going to do this new thing and hire a director for it and let it kind of be on its own, would be something that I would recommend.
That makes a lot of sense. And I would just add for us, really small steps. Don't get ahead of yourself, and keep going back to make sure that you didn't miss your staff while you were moving forward, because there were plenty of times where, the executive level staff, we're all having these conversations and we're sure that we're doing the right thing. And then we, go back and the staff were kind of like, they hadn't kind of caught up with that. So going back and checking in, making sure that, and also in getting to know our partners, and those folks in the community, like the primary care practices and stuff, getting to know them, and also helping them understand, because they're really busy, and it's not that they don't want it. Like one guy told me, if I ask all these questions to in my 15 minutes, if I ask about domestic violence and they say that they have these problems, what exactly am I supposed to do then? And so what we decided we were going to do was find a way to partner with them so that we could say, you're going to call us and we're going to help you. And so establishing those relationships early on, where people see the value in what you can do to help them be able to do what they do better, or more efficiently, or whatever. So I think, had I known that, like, we had all these big picture goals, but when it was like, oh, let's get to know the family practice receptionist, because she's the person who knows more about what's going on and will communicate with us in a different way than trying to bother this poor guy who's got back-to-back people,
Yeah.
So it's those kinds of things, I think.
Yeah. Well, I certainly appreciate and value all of your insight. Again, you three are just experts in this area, and it's been an honor to have a conversation with you three. I hope the listeners were able to take something away. Not seeing any questions specifically yet in the Q&A section, but please reach out to anyone on our marketing team or myself for additional questions, and we can expand or maybe connect you with these leaders one-on-one. So, okay, looks like there is one question. Before we jump off, I was just about to let everyone go, and now we have one question. Can you speak to the use of telehealth and its appropriateness as a treatment modality in whole person care? It's very interesting.
We all want to jump in on that. It's like that. For us, it's a mix. We have some protocols that we try to determine what's the best pathway for the individual. But I'm going to be honest with you, we do believe in that we still need some, personal interactions that are not virtual. So we still route that. And a big piece of our business is community-based work. We have people that are navigators, and a lot of the best outcomes we've had is holding hands with people in the community and helping them navigate difficult situations and systems. And sometimes it's literal hand holding, like we're right there next to them. So I would just say, if you have a good telehealth platform and you have the right people on both ends that it's a good fit for, then it makes sense. But we've seen on both sides where you have practitioners who maybe it isn't the best thing for them, but their feeling of what they want to do and what is a good fit for them doesn't match. But other places it is a match. And it's the same way with the individual and their presentation, whether it's good. And I'll leave it at that.
Yeah, I would just add to that, we've seen it as an evolution. It went from an emergency kind of service to a treatment modality that really should be specific to the person that you're treating. So what we'll do is, like, during the intake, we'll ask a lot of questions about any kind of barriers to coming in person, which is usually our default. Is we try to get people to come in. If it's transportation, then we can help out with that. Is that the only reason that you want telehealth, or if there are other reasons? And then we would decide if we think that this is the appropriate modality for this individual person. Sometimes we'll come up with a kind of a hybrid approach to telehealth. Okay, fine, we'll do telehealth with you for 3 sessions out of the month, and you come in for 1, or you come in quarterly or something if it's the prescribers who are seeing the person. But I think it's an evolution. I don't think it's stopped yet. The other thing is we did a survey of our consumers in 2021 asking them what they preferred, and it was overwhelming. Nobody wanted to come in person. It was like, we just want telehealth. Today, we're having to ask our staff to come in more into the office more hours because the overwhelming majority now want to be seen in person. So it's got to be part of an evolution and also based on the treatment needs of the individual person. So Anna, you were going to say something, I think.
Yeah, so yes, I would agree. I think it's very individualized, and it's how do we best serve the patient in their current setting and how do we provide that care, right? But one of the ways that I think telehealth has helped us very significantly is it has been a way to connect our community-based teams to our in-person teams that are in the clinic, right? So we'll have teams that are out in the community. We have a portable care pilot that's actually staffed with a behavioral health technician, a nurse, and a behavioral health professional. And they go out into encampments, into the community, do outreach to patients, and then get them connected if they need something via telehealth platform to our primary care provider that's at one of our clinics, or our behavioral health provider, or a clinician for an intake for residential treatment. And that has been a really successful approach for us and a good use of telehealth, because oftentimes the patients that we're seeing aren't interested in coming into the clinic. They've had negative experiences. They've, they don't know how they're going to get there. All of the things, right? And it allows us to get people connected to care at the point of service when we're right there with them. And so that's been a really fun and great opportunity for us. And I think we're going to continue to see that evolve. So.
Very interesting perspectives. And it does feel like at a point in 2020, this pendulum swung very far one way, and now it's kind of swinging back the other way. So I appreciate those different perspectives. And that was a great question that came through last minute. So if there are no other questions, we'll go ahead and wrap it up and give everyone a couple more minutes of their lunch break, I assume. So thank you all for being here. Really appreciate your time. And thank you again to our wonderful panelists for joining us today.